Andrew Kramer, Urology Associates, Cape Cod, bringing you case number 5 of this given day. This guy has an athletic family, and it definitely runs in genes in the family. His brother played in the NFL for the Patriots. This guy was a collegiate athlete, played multiple sports, so his father was an athlete. Anyway, he comes in, he's got Peyronie's disease. I should have mentioned that in the title, but it's distal, so he's got this scar all the way at the tip of the penis, and that sort of started the spiral to ED. And he is in the situation where he didn't want to date because once he got started, he knew it would get stopped at the ED sort of level. So he's doing this not with a partner, but because you couldn't obtain a partner in the state he was in, which is so common. I see this situation a lot. I totally understand it. Your confidence is shot, and when you're trying to engage and try to meet folks, that is coming, that issue. So get the implant done. And I told him as the reservoir goes in, by the way, he had hernias and all sorts of scar tissue as athletes sometimes have had. Reservoir goes on the right, very uncommon for me being right-handed. I usually put on the left, but cylinders in. So he does this before he dates, and I think, in a couple of weeks, he's fixed. That's all it takes, 15 minutes of work in 2 weeks. So that's all I told him, and he said, I never would have ever done an implant. I talked to you for 20 minutes. I'm on board. We connected in that way. So cylinder 1 is in, cylinder 2 is in. I'm going to close them, just show you kind of the detail. In this case, just how I sort of close the corpora. But you make the corporotomy just big enough to fit the cylinder, but big enough so that you don't struggle on the in and out. I mean, there's points where I was sort of pushing the envelope in both directions, trying to do the surgery faster, yet also sort of make the tiniest corporotomy possible. And you struggle because sometimes the cylinder is not so easy to get in, and sometimes you're sort of in and out trying to get the cylinder to be perfect. And when you make the corporotomy just a little bit bigger, you get the perfect cylinder every time. That makes your surgery faster. So I'm closing the corporotomy now on the right side. I'm going to test it, doing multiple closures because I don't want bleeding and I don't want a herniation of these cylinders down the road. And I've almost never had that happen. So multiple layers of closure, closing, putting the reservoir and pump together. I don't need to do any more splicing than that in this specific case. And when I pump them up, that distal plaque and scar really never reared its head in this case at all. Didn't become an issue, didn't bother us, didn't affect me. So that was great because distal corporal issues are the hardest issue in prosthetic surgery. Prepared for it, was loaded for bear, didn't become an issue, thankfully. This guy gets a great result. Dissolvable stitches in the skin, off to the races, ready to date in a couple weeks. Andrew Kramer, Urology Associates to Cape Cod. Thank you.